Welcome to the Sundays with Wendy podcast, Dr. Kapil Kapoor.
Thank you, Wendy. Thanks for having me.
Yeah, such a pleasure to have you. You were with Wagner Kapoor Institute here in Norfolk.
Yes, I've been
Right.
here now for 12 years. It's surprising to say that out loud.
Wow, I know. Our paths have not crossed. We were introduced about a month or so ago from a mutual friend, and I'm so glad. She told me
Yes.
that you had a lot to share about patient care and caregiving as you see it in your clinic. So I am excited for this conversation.
Yeah, it was great when Lisa introduced us, and I could tell at our first chat we're going to have fun with this. So thanks for having me again.
Love that you care so much about your patients to want to see it differently.
Yeah, I appreciate that. I think a lot of that comes from my background is at Mayo Clinic. That's where I did my retina training for 2 years in snowy Minnesota. And you learn all the knowledge and you get all the experience there. But I think one of the biggest things that sticks with you is the ideals about patient practice and treating every single patient as what could we possibly do to make sure they're getting the best experience, and are we absolutely sure we're doing everything possible for their healthcare. So then I had the benefit of working with my great partner here, Alan Wagner, who shared those same ideals, and that's kind of how we've built our institute, over the last several years. So it's a part of everything we do every single day, and it's exciting to carry it out.
Well, tell me a little bit about what you're seeing in your clinic right now.
Yeah, that's a great question. So, one of the things I'm seeing a lot is medicine is changing. I mean, we're seeing a lot more about the business side of medicine. And I think it was a year or two ago, the AMA does all of these medical practice statistics. And for the first time a year or two ago, they reported that more than 50% of physicians are outside of private practice, which is the first time that ever happened. When I read that, my first thought was, is this going to change patients' care? Are they not going to get individualized physician care? And I think that some of that is at risk of happening. So,
Yeah.
what do I mean by that? That means if they're not physician private practices, there are physicians that are part of corporate medicine. They're part of big institutions. And I think the concern that patients need to be aware of is some of those changes could happen under their awareness. It might be the same physician you've been seeing for a long time. The building could be the same, the staff could be the same, and changes could be happening under your awareness. And one of my hats I wear as a Mayo Clinic alum and as being just a patient advocate and a patient ambassador, um, and just an advocate of education in the healthcare space. As an instructor at EVMS of the residents, is I really think patients need to be educated about this. And that's something I feel very passionate about.
Well, can you share a story with us about something that's happened recently that's caught your attention?
Yeah. So there's so many I could think of, but let me share one. I had an aunt in New Jersey that was going to have eye surgery, and they were going to use a special device that was going to drain fluid from her eye at the same time as this cataract surgery. She called me and said, "Hey, Kapil, what do you think about this?" And I was like, "Well, this is a very new treatment. I'd love to chat with your doc about why we think that this is beneficial for you." And so I actually called the doctor up and we chatted a little bit and we had a lovely chat. And then afterward, I reviewed the data and I went back to my office. I was like, I don't think that you critically need this right now. When I look at the risks and benefits, I think you should stick with just having cataract surgery. And everything seemed fine and she accepted my advice. And then a week later, that doctor called me back and said, "Why did you tell your aunt not to have that procedure? I thought I explained everything to you." And I was like, I just relayed it to her in layman's terms. She made her own decision. And he's like, "Well, I had a rep coming to help me learn this new treatment that I was going to do on your aunt." And, you know, right there, that whole thing gave me pause, and I realized that this was a doctor that was practicing corporate medicine and was clearly had not given my aunt complete informed consent that that was going to be his first time doing it. He had set up something that had a financial reward to it. And that's another example of a patient having lack of complete informed consent for something as delicate as eye surgery. Now, that being said, I'm sure that that procedure would have likely gone fine, and the risks were reasonably low. But it's just one example of a missing link, or a gap in information that I think as patients we're entitled to know about.
Right. And we don't always know all the right questions to ask. With such a what is the average time a doctor can spend with a patient?
Yeah, those are two really good linked things. Knowing the right questions and time. And I
Mhm.
think those two are both so intimately related. So I think everyone in the healthcare space, whether a provider or a consumer or an administrator, we all need to concede that there is less time within the healthcare space. It's just the way the whole system is. And as a provider, I feel compelled to try to make sure the patients in my community can get the eye care they need. And certainly sometimes there are times and pull and push for time. And I always try to make sure patients have all the time they need. But I
Mhm.
still at the same time want to wear my hat of patient educator and want patients to make the most of the time that they have with their provider. And that comes back to your other word that you use, which is questions. So I think it's good for patients to come in to that office with questions. And I'm so used to as a consumer in the retail space to having questions. Like one phrase I like to use is let's put on our Amazon cap or our Amazon brain. Like we're so used to going on shopping on Amazon. And I would say my 14-year-old teenager, but now even my 8 and 10-year-old son and daughter can go on Amazon and pull up a product, and they will tell me that this has a 4.7 star rating. The poor reviews were because of something nominal, like one mistake. They can tell me exactly what the cost is and when it went on sale, when it's going to get delivered, where it's coming via, and they'll know it's going to be here at 2:36 p.m. tomorrow via Orlando. Like they have all this information, and we're so used to that type of information, and yet I think we're used to a possibly old form of healthcare. Whereas consumers of healthcare, we might come in and ask our doctor, and the doctor might say, I recommend this for you. And we might assume that there's the Hippocratic Oath, this doctor wants what's best for me. I'm going to accept this treatment and let's move forward.
Mhm.
And in a utopia, I want to believe that's true, but I also think that we as consumers of healthcare should learn to start putting on our Amazon cap and start to ask some serious questions about what's on our mind just to make sure we're protecting ourselves.
I love that analogy. It's because it's so true. I mean, I feel like there is a true disconnect in the way we're approaching this mass amount of information that we're consumed with. I am an oncology patient, so I have a lot of interaction with my doctors, and I also am a CPA and had clients that were doctors. So I don't know that I consciously made a decision that I was going to do something that actually worked, but because I would get kind of emotional when I would go to the meetings about, a possible treatment or what have you. And I had a team of doctors that I was working with. So it was very important for me to keep everybody in the loop. So I just got in a habit of shooting off an email before I would go to the appointment. And maybe it was an article I wanted to see them read, or just to let them know I'd read the scan and I had a specific question. So it was very, very quick, like, hi, doctor, see you then. Boop, boop, boop. Bye. And what it did for me, it got all that off my chest. All the things that were important to me were now in an email and shot off to her that she would read, he or she. And then when I went to the appointment, I really wasn't emotional. I feel like it created this very neutral conversation that wasn't reactive by me at all about what she would say or what she would do, and she came prepared. And then she told me she like later I said, I apologize if I send these emails and they're annoying. And she said, "No, I actually love it."
I love that, Wendy. I think that right there is a little key to success for healthcare to be able to do what you just said. You saw from your side, it's empowering to you as a consumer of healthcare. And you
Mhm.
heard from your provider, it's empowering to your provider. I sense often from patients in the room, there's almost a palpable tension that they have concerns and sometimes don't know how to articulate it. Like I sense patients have a hesitation and they might be afraid their question's too stupid, or they're afraid that they don't want to take up the doctor's time, and they're afraid it's going to come out the wrong way, or that they already may have gone through it, or they feel rushed and can't articulate the way they want to. And I think um, I totally want patients to be able to use that time to get the information they need. And I think you're right with the way you said it. It takes the emotion out of it. I think that's great. I love
Mhm.
it when patients do that. So,
Yeah, and there's just a nice exchange of information. I don't know, I just found it to be really cool. And I had doctors as clients, so I kind of over the years knew how they communicated. So I kind of was like, okay, I just need to do a really simple bullet. So
yeah.
anyway, I do it all the time.
I think another thing you just said there is great insight. Like, you work with doctors and you knew how to get information in that setting. And I think, if I have one goal here, I would love for patients to be able to know, most providers, most physicians, their goal is to be accessible to patients, to get them the information they need. And most patients want to get that information. So I just want to address that gap, because there's a gap there. And the way you said it, anytime we have a question, I'll be out to dinner with friends, let's Google it. Or if we need more information, people are on ChatGPT and they're getting bullets to every possible question about things that are, in my biased opinion, much less important than their eyesight. You know what I mean?
The other part of your health care, right?
Yeah, but because it's something so delicate, I think we should approach it with a little bit more diligence. And I'm not saying don't trust your doctor. I'm just saying trust yourself and trust what questions you have, because only you as a patient know what you need to be comfortable with that next step. Like, no one else knows that. Google doesn't know it, ChatGPT doesn't know it. Your doctor may not be able to address it in the time you have, or may not be able to pick up on that. So that's it. I just want patients to be able to, address that.
I know. And then I sometimes I feel like there's just this, maybe it's an invisible sense of urgency patients feel. Like when they go to the doctor, then they have to make a decision like right away. Like, okay, now we're
Yes.
going to schedule the surgery or what that is. But I've found that sometimes you have to say, no, I need some time. Like, just hit the pause button. And I know, like in my world in oncology, they just want to schedule, okay, chemo Monday, chemo Tuesday. But you have a right as a patient to say no. Like, I need to think about this. I just want to make sure this is right. I mean, there's really not that too many emergencies, right? I mean, there are, but in most cases, the scheduled procedures are not. I know, for at least for myself, I mean, when you go to a doctor, you have a lot of questions, but you have to really process that information. Right? So, I
I
mean, that
yeah, I fully agree with that. So a couple things I love to lean on there, like usually after I inform patients about something, I sometimes sense a pause. And if I sense a pause, my follow-up questions are usually, is there more information I can give you to help clarify this, to help you make a decision? Or two, are there others you usually lean on or chat with about making healthcare decisions? And can we include them in on this conversation? And they might be there out in the lobby, they might be out in the car, or they might be accessible by FaceTime, and we'll call them by FaceTime if they want to, or invite them that they can make another visit to do that. At the flip side, I would advise patients to exactly what you just said. What helps, I think, as a consumer of that sense of urgency you're talking about, is to come in prepared with, a reframe of that, like, doc, what can you do to help me make a decision here? What can you do to help me get some time so that I can come to clarity on this? Because I think for so many reasons, those questions just don't come to you in the moment.
Yeah.
So I think having those prepared is helpful, you know?
Yeah. And the average age of your patients is, what, 60?
Yeah, yeah, we have retinal detachment and diabetic retinopathy often is 50s, early 50s to late 50s, and then macular degeneration is often mid 60s and beyond. So those are the two big conditions, two to three big conditions we treat.
So in that population, a lot of times they'll have caregivers as adult children, right? That are in those conversations.
Yes. We see such a wide spectrum. And inside that spectrum, having done this now for a dozen years, which is surprising again to say that out loud, but I see so many moments where I can see patients trying to capture information even in the doctor visit, even at that time with me. Some of it might be on their phone. Like if I have to step out for a second, I can tell they're trying to Google something right there to kind of capture information, and their eyes might be dilated so they can't make out what they need to. Or they might be looking at the care provider who's with them and trying to fish for what does this care provider think, and how can I help make a decision here? Another thing I would add, and this is kind of slightly tangential but related, uh, even caregivers who are coming with a family member, it's great for them to come with questions and for them to not just be a set of ears, but to be a voice for their healthcare. And even there, I can see, just like the example I gave you of a doctor earlier, I could share several examples of some people in that caregiver seat um, that might be confounded in a way. Their questions, um, in my space with eyes, it requires sometimes a lot of caregiving for the visits. Visits can be very frequent. Like many patients need shots every 4 to 8 weeks for years. And some patients need to be face down after surgery for up to 10 to 14 days, which requires a lot of caregiving. It can change household responsibilities. And inevitably, there's moments where caregivers' questions will be maybe not rooted in what's best for that patient in the seat, but about scheduling convenience, or, can that caregiver be supported? Um, and I think just being informed and knowing that energy and making sure they're asking questions is really supporting the patient, I think is a really important thing to have.
Yeah. So what advice would you give to a patient and or their caregivers as they come see you? I hate to use the word efficient, but like are um,
Or
you
just
know,
maximize, make the most of that. I think coming into the visit with a list of questions is a great thing. And they could be as hyper prepared as you were, and try to email the doc or write them down. I think writing them down or having them on notes on your phone, I think things like that are great. Some things that I think are good for patients to be informed about, like a reasonable question, is who makes decisions in this practice? And if you get an answer you're not familiar with, the follow up would be, are the decisions made by doctors? So that was my biggest concern when I saw that AMA statistic. I feel passionately that medicine should be practiced by healthcare providers, and decisions about healthcare should be made by healthcare providers and not by businesses. And I think that's something that should remain somewhat sacred. So knowing where your answers are coming from, or if they're coming from providers, I think that's important. A question about how patients are coming in and out of that practice. So you and I had a discussion about the gray zone, or this nebulous uncertainty about how did patients get to the practice? Did they get referred by their doctor or by their insurance company, or were they word of mouth, or did they look them up online? A patient should internally ask themselves, well, how did I get to this doctor? Like, was I referred by my doctor, or is there a reason? And if they're not sure, ask your doctor, why was I referred here? And I think that's very reasonable to ask.
I like them.
Another
Yeah.
thing is the same thing. If you're sending me to a specialist, why are you picking that specialist, and making sure they're really the best for you and not because of some corporate reason. Another thing I try to tell everyone is, even if you've got all the information you need for your eye condition, for my patients, or any healthcare condition, you could say, what are one or two or three things that I could do to improve my eye health or my outcome or my condition? And I think that is something that might go beyond what your doctor's already advised, but it's making sure you're getting any other little extra information that's possible. Um, one more I would say is there one question that you wish more patients would ask? And I think a lot of doctors have their own advice that they feel like they would throw out at that moment. And I think if you come in empowered with a list like that of 3 to 5 questions, those are kind of general, that are outside of their specific diagnosis. I think that's starting that step of the Amazon brain and getting more information.
Yeah. I know. I mean, I'll get referrals sometimes and I'll Google them first, just so I can just connect with their photo too, right? To get a sense of them before I walk in the room. I'll know if they're 40 or they're 70, so that helps, to prepare as I
Right.
kind of shift the way I communicate sometimes.
And sometimes their picture's 40 when they're online, and you come and see them when they're 70, and they haven't
Oh,
changed their picture in a while.
too. I don't know, but nowadays you can get more than one, right? Everything's
Yes,
so
that's true. So I think that reflex is so seasoned, right? We're so seasoned to, we get any information, anything, we go online and get more information about it. We're
Mhm.
just so, that reflex is so sharp. And that's the same reflex I would encourage for patients when they're with their physician or any healthcare provider. Let's have that reflex to, we're here, we're getting information. Let's get more information, and we can get it right here with the doctor instead of going home and Googling it or chat GPTing it, etc.
I've just felt like I've had some really great conversations, but when there's this just fluid way of the communication just continues from both sides. I mean, in the oncology world, I mean, there's so much changing so quickly. Like I'm sending her stuff and maybe she hasn't seen or it hasn't crossed her path yet and vice versa. So I don't know. I mean, I felt, in my career too, I always feel like I learned from my clients. I never felt like I knew it all.
Yeah. No, I think it's always neat when patients bring me information. A couple examples I'll share of that, like there have been a couple medicines that were run in the pilot over the last 5 years that seem promising, and patients bring them to me, and we would have great chats about them. Sometimes I would say, well, there's no level one randomized control trial evidence for this, so putting my Mayo hat on for clinical evidence, I can't necessarily endorse this now. And some I would say, listen, I'm excited about this treatment, Wendy. We're part of that clinical trial out of our Norfolk office, and we have patients enrolled in it. And I can give you more information if you want. So it's been neat to participate in some of those discussions. And you're talking about learning from patients. I'll tell you one example. There's a treatment for a certain condition called central serous retinopathy, which mostly affects young males. And my partner, Alan Wagner, and I wrote about 5 or 6 papers on that topic. About 7 or 8 years ago. And the first patient that we utilized this treatment on was presented to us by a patient. His patient looked up this case report in animals, and it was obviously a safe pill used for other things, and wanted to try it. And we worked through that. And then it started something that helped people throughout our practice, and through the country. Absolutely, providers can learn from their patients, and providers can use that information to help extend the impact to others, which is exciting. That's one big example I can tell of. If that happens again, I would be over the moon. So
I love that. I've just been in these longer healthcare journeys, if you will. I mean, I think journey is a word people are using more when it comes to your health. And, when you
yes.
really think about it, your health, I mean, it's not just a check the box, right? I mean, you really have to pay attention to your body the whole time you're in it, right? And I've just had some great collaborations with my doctors that I just feel like add so much to the outcome really. But, let me ask you a question. So as a physician,
Yeah.
this podcast is about healing obviously. So I'm just
Yes.
curious. I'm going to ask you a question I ask all my guests.
Lovely.
What does the word healing mean to you?
Ooh, that's a good one. Yeah, I mean, from an objective purpose, for many of my patients, they come to me with a vision problem. Like by the time they're coming to a retina specialist, they often have a very specific problem. And for many of my patients, helping restore their vision is, my easy answer to that question. I think for many, either we can't achieve that or we can't get right back to that place.
Mhm.
But most have some secondary goal, like either because of their vision change, they're missing one specific activity of daily living, like being able to drive or read their book they usually do before bedtime, or they start their day with coffee and the newspaper, and because they can't read the paper anymore, they feel like they can't get their day started. So something very specific. And then the other big buckets are retaining their autonomy, so being able to stay independent and
Mhm.
staying away from social isolation, because a lot of vision things will get my patients isolated. So I think those are the secondary healing journeys that I'm often a part of. And it can be really neat to be a part of those journeys. And some of the journeys are small, some of the journeys are long. I feel fortunate to be in a field where, for the most part, we can help patients achieve those journeys. And that's part of what drew me to eyeballs. Is I felt like, it's an area where everyone's emotional about their vision. It impacts you in a big way. And for the most part, we have science on our side being able to heal a lot of those issues. So that's my long-winded answer
No,
to
I love
healing.
it. I was really curious how you got in the field. I know, so I wear contacts, and when I take them out, so I'm both. One, I've mono, so the contact one is for one's
Distance
for
and
the
one's for near.
but when I take them out, I can't see anything.
Yeah.
I mean, and
And
I
it's,
mean, sometimes it's kind of shocking because even in my bathroom, I kind of even get frightened for a minute,
yeah.
grab my glasses or put another set in because you really can't do anything if you can't.
Yeah. And you've been used to that reflex. Yeah. You've been so used to that reflex and navigating that for those moments of each day, morning and evening. And you can imagine how that fear comes in for someone that wakes up with a curtain in their vision and comes in for the first time, or had their first bleed from diabetes affecting their eyes or from macular degeneration. It impacts their world. It impacts many people in their family, it impacts their autonomy, their schedules, possibly affects their profession or the only paycheck for that family or for many people counting on that. So it's very, very humbling to be on those journeys with patients. It fills my day with a smile. And for the most part, again, science is on our side, research has been on our side, and for the most part, we're able to navigate those journeys with success. And again, it may not always be exactly where their vision was. Hopefully that is, but addressing those secondary parts about what healing means to that patient, with social isolation, autonomy, and their activities of daily living impacted.
I know, a lot of the work we do at the foundation is about these non-medical interventions, that help people with anxiety and depression go along that are hand in hand really with some of these illnesses. So what I really love about what we do is it's not just one, there's an array of things that
Yes.
you do that are healing. Some people aren't going to be drawn to maybe the nutrition part or the meditation part or the movement part, but I mean, there's so many things that can help our body heal. And when something is off, we're not in that state of stasis. It's rattling.
I totally agree. And I think so. You brought up another few great buzzwords there that I love.
Mhm.
And I think that's another set of examples of things that might not immediately come up at your doctor visit. And so when I think about adjunctive treatments or overall, I'm talking about eyeballs, like ocular wellness that may not come up, that you're talking about, like, the obvious ones we all say there's evidence that you shouldn't smoke. Okay,
Right.
understood. But other things like always blocking UV lights, the increasing evidence of better sleep hygiene and how sleep hygiene over the course of years is affecting people's eyesight. Under or overexposure to sunlight over the course of one's life. Sleep apnea and how so many people are underdiagnosed and that's affecting their eye health years down the road, or other vascular comorbidities, how it's affecting their blood vessel health in their eyes. There's so many of those other things that are a part of eye health or adjunctive health or healing or wellness journeys that I think would never come up in a typical eye visit, but it probably comes up in a lot of Google searches and ChatGPT when we're searching, about how we can do better. So that's another example of things that I would encourage patients to chat with their doctors about.
Yeah. Everything in our body is connected, right? And balances with another part. And sometimes when we go to a specialist or some you are hyper focused when you're at the dentist on your teeth or at an eye doctor on your eyes, but there is so much interplay in the human body.
Yes,
It all matters.
it all
I remember
matters. I agree.
modeling my house, and it was a total gut job. I kept the front door in the steel tub, but as the project went along, I was like, every part of this house is important. The plumbing's important as much as the HVAC, as much as it's like our body too. If one piece of it, one part of the house doesn't work, you're all out of
Yeah, I
whack.
totally agree. Everything is very holistic and functional. I think a lot of times we don't come to that realization until something's not doing its part. You know what I mean? Like some part of your body is not doing its part, and then we're more aware of the interconnectedness.
Hmm.
You mentioned your house. I remember one time I had a very silly injury that I don't have a good story for, but it was a dancing injury, and I was
Okay.
dancing, and I hurt my big toe, and I couldn't really do a lot of things normally for 4 weeks because this toe took a long time to heal, and I actually had to have my partner do surgeries for the practice for a couple weeks while my toe was healing, and I couldn't even walk very quickly because of my toe. And I didn't break anything. It was just silly. It was just like a sprain. But I was like, gosh darn it, that toe is important. Like every toe is important. Everything is important.
Everything is important.
And everything is related. And then when my toe wasn't working, I was like, gosh, I couldn't be fit this week. And I gained a couple pounds because I was more sedentary. And, it all, it kind of just ties in together. I don't think it affected my eyes, but, you
That's so funny. I know, because sometimes when I fill out, paperwork, but I'm wondering why aren't they asking more? You know, because there's so many things that impact our health, but maybe that's coming.
I think we're seeing that. Yeah, I think your question's fair, and I think that's coming back to question and answer and exchange of information. And I think I'm encouraging patients to ask more, and you're encouraging, why aren't the healthcare providers to ask more? And I do think this is again tangential to our chat, but I think that is an opportunity for AI to come in, and this is being tested in a lot of ways because a lot of things that we didn't think was related is we're finding out is related. Like like a small example, like when I look in the eye and look at the retina in the back of the eye and dilate the eye, I can look at the blood vessels directly. And we're finding that how wide or thin someone's retinal vessels are could be a predictor of their heart health. And we never knew that until that was put in a large AI algorithm and then it spit out this data. And I think we're going to learn a lot more details just like that about things that we didn't compute as relevant before. And AI is going to merge a lot of information and start to give us more predictive information about our healthcare. And I think we're going to have a lot more of these everything is functional, everything's holistic, and more aha moments and more of an awareness of the interconnectedness of our health into a whole. And hopefully we'll be better informed because of it. So I think that's coming. And I think that's a great use of AI in healthcare.
Yeah, I mean, I love it when science, I don't want to say catches up, but like it's just such an influx with AI. I mean, when you think about a couple of years ago, I think I was just at lunch or coffee, and we were just started talking about AI, like Chat GPT. It was like a joke at a party. We were like made a poem or something, and now it's like I use it. I can't even tell you how many hours I use it every day.
Yeah, I mean, my kids love using it, and they'll use ChatGPT to make all sorts of different pictures and drawings of different things they had never thought of before. And the amount of information, the way it merges things so quickly that we couldn't think of, I think it's neat. And so I agree. I think there's a lot of fear about how AI will come in healthcare, and will there be takeovers, or will there be robotics, and will we lose the human touch? And I do think we need to be careful about all that, but I think there's an interface there that can be patient protective and patient informative, and work as an assistant to the healthcare's providers. And I think that'll be neat.
I find it exciting, and it's here. Um, and I kind of dove in.
Good for you. So
Yeah,
you
and
have you
well,
used it for your own healthcare journey specifically?
well, I've used it for like in my CPA firm. It's great for templates. It's great for outlines for meetings. Just and what it does is it gets me started, and then I kind of can go from there. So if you're procrastinating a little, sometimes I'll just pop it in there, and I'm like, oh wow, you know, and then
Yeah.
I can go. But in my own healthcare, yeah, I just recently I was stopping one immunotherapy treatment, and I'm going to something I don't know if a lot of people know about. It's a mistletoe therapy. So it's actually a
Hmm.
therapy from, the tree. And all right, for a patient and put everything in there and then ask it a question. And I said, do a deep dive. And it came back with more information in maybe a minute than I have over the last 3.5 years researching
That's
on
really
that.
neat. That's
And
really neat.
I don't assume all of it's correct, but so I'm like, huh, okay. I think it's just going to be everything's moving fast these days, right? So
Yeah.
I know at my age and my early 50s, I'm glad I have the tool, to keep me up to speed.
Well, I think consolidating that information is going to, and my hope is, enable patients to ask, either feel more confident about the questions that they get from that information and just feel more prepared about bringing those questions into the healthcare space, because it's fine tuning it in a way that they feel comfortable with. And maybe helping them think of some questions they didn't think of, and how that healthcare situation relates to them. So I think there's a lot of good.
Yeah. And I think these healthcare conversations, well, at least in my experience, have been very open-ended. They didn't begin and end. They kind of continue. And so it's created an opportunity, I think, for me to like learn how to do it and make it work. And I think
Yeah.
other people can too. But maybe we just don't give ourselves the permission.
I think you're right. I think permission's another big important concept. I'm giving all my patients permission to ask all the questions they need to, and I want patients to feel that way. And I think, when you're on that journey, to keep that discussion going back and forth. Like, I love it when patients reach out outside of their appointment time or say, I just had this concern, I want to come in earlier. It's a journey and it's a healthcare relationship. And I think both of those allow that type of, open exchange of information over time. And I've always believed patients that are the most informed, families that are the most informed about the patient's healthcare have the best outcomes. So I've always thought about that as one of my responsibilities, where we have, you and I have talked about this. Some of our clinics are in rural satellite locations, and some of them are right at the ocean front. Or sometimes I might do a remote telehealth visit for an urban site. And how do I configure that information to make sure that patient is fully informed, the family is fully informed to get the information they need? And I think that's an important responsibility in the healthcare space that everyone should be aware of.
Yeah. Well, I am sure your patients appreciate you as a physician. You seem to care very deeply.
Well,
Um,
that's very kind of you, Wendy.
yeah. Well, thank you for coming on. There's so many topics to talk about. You were going to very graciously serve on our caregiver series that we have rolling out in June, and you're going to do a session with us about your insights on caregiving as you see it. So we're very grateful for that and excited to share that as that rolls out. More
Well, thank you so
conversations.
much, Wendy. Thank you. It was so great chatting with you, and thank you for having me on.
See you soon.